to get funding to do these training sessions through Foundation Derbyshire, a fund that was to help infrastructure organisations like RAD and CVSs to give that extra support and deliver, you know, and we've been able to deliver these sessions free of charge. Normally our training sessions, we have to charge for them. So we're really pleased that we can offer them on this basis. Last financial year, so the end of March, we delivered 8 sessions, and now we've got funding to extend that to the end of September, which is really good news. And so we're going to do 6 further sessions. So this is the first of the 6. So up to September, we will be holding a monthly online Zoom, really to try and keep up to date with what is happening. So we're not going to have a specific theme. I know in the past we've done like a theme, finance or marketing, and quite open for just talking about the reopening process and how that progresses. I mean, we don't know if things are going to change in the coming months, but fingers crossed, the 4-step roadmap should be, you know, we're hoping that that will go according to plan. So we'll kick off then. What we'll do is have about an hour, and then we'll have a 10-minute coffee break, and then we'll go on till 12 o'clock. If we go a little bit later, you know, if there's lots of questions, do 12, but if not, then we will try and finish at 12 o'clock. So I think most of you know RAD. We're an independent charity. We'll be celebrating our centenary in a couple of years' time, but the actual Village Hall service nationally is celebrating its centenary this year. So I'm sure some of you have seen the Doomsday book that we've been promoting this year. And if you haven't signed it, there's still time to sign that. Just go onto the Acre website and find the centenary year Doomsday book page, and you can very easily sign up to that. I think there's about 750 halls so far nationally that have signed up, so that's really, really good. Right, so we'll go on to the agenda, which is the next page, Skye. Thank you, that's great. So this is quite a loose agenda in a way. I've not set time frames next to it, depending on questions and how we proceed. But mainly we're looking at, in a way, key challenges that village halls are facing due to COVID. Some halls have remained closed all the way through. Some halls reopened and then had to partially close and then in lockdown again. So there's quite a variety of experience from different halls. So, you know, joining us today, I'm sure there's a lot of experience ranging from not being open at all to perhaps being open throughout for halls that provided a facility for key workers and essential services, that sort of thing. So it's based on the 4-step roadmap to recovery, which is a government roadmap. I'm sure you're fully aware of that. And the Acre information has interpreted that and how it applies to village and community halls. So there's a lot more to the 4-step roadmap. It's not just village halls, obviously. Then we'll talk a little bit about what it means to be a COVID secure venue. And I hope you're familiar with Appendix D. And if you've been reading the recent newsletters, there is a new activities table. So that's a new extension to Appendix D. We'll talk about that. A little bit about the update on any recent regulation changes to that roadmap, because they do tweak it as it goes along. So once it was launched back in March, it has changed slightly, and that has got implications for village halls. And then we'll talk about the financial support that's available through the Restart grants, touch upon the importance of the special conditions of hire, and then of course questions and answers as we finish the session before coffee, and at the end there perhaps be more time to ask questions. What we'd like you to do, if you think about something, rather than saying it there and then, put it into the chat box. So I don't know if you're familiar to the chat box, but at the bottom of your screen, when you see the little icons at the bottom, there is a chat box which you can click in, type in what you're wanting to ask. We'll hopefully keep track of those, and we'll try and answer them as we at the end of each session. Next page, Skye, please. Now, for those that have attended the last session, I think there's 3 of you that attended the last session. I'm going to have to apologise because some of the slides initially, it's repeating what we talked about last time, but they are quite pertinent. So it's just information that's going to be useful to those that didn't attend last time. So please bear with us on that. So what has changed during COVID? Obviously, a huge amount more legislation, and halls have had to comply with that, and they are worried about public safety concerns. Community needs have changed. Obviously, people working from home in lockdown, and demographics of communities are changing as well. So less younger people in rural areas. That can have an impact on the care for people living in rural communities. And I think we've all, in the last year, had a much higher reliance on IT. And that's affected people in different ways, because it depends how, what their experience and capacity is with IT. So changing needs, it is a changing landscape. Village halls obviously have been extremely worried about the spread of the infection. They've been worried about whether they would be liable if anything was attributed to their hall, or what anything they do in their hall. So things over the last year have been very, very difficult for volunteers running these halls. It's very hard for them to cope with. We've navigated through 3 national lockdowns. Restrictions like social distancing, hand washing with the rule of 6, face coverings, test and trace, QR codes, tier systems, and now the 4-step roadmap to recovery. And we don't know what's going to happen next. So it is a changing landscape. Next page, Skye, please. So I thought I'd kick off with, these seem to be the key challenges that halls have identified, which puts extra pressure on the volunteers to cope with. Pandemic has obviously created great uncertainty. The changing use of your halls as part of the COVID response. So you may have had to host vaccination sites, you may be open for food banks, so it's a changing use. So halls have had to adapt to that. And all of these changes and all of this legislation has in many cases led to what they call trustee burnout. People are getting so worn out and tired having to cope with all these changes. And that is a real concern, because there's energy and commitment is needed to go through the next stage, which is the reopening and reinvigorating the village hall. So trustee burnout is a big issue and a big challenge. A challenge to re-engage your community again. You perhaps lost contacts with some of your user groups. Perhaps some of those user groups are no longer around. You may have to try and look for new users. So it's going to be difficult to re-engage back with the community, but there are opportunities there as well. So don't look at that as too much of a negative. Changing needs of the community. There are more people working from home. people are perhaps more keen to get out and socialise after that long lockdown. So it's not going to be the same as before. So you've got to look at the opportunities and the changing needs of what your community may want in the future. So that's another challenge. Changing trustee skills that are needed on your committee. So there's been a huge reliance on digital, marketing, strategic planning for the future, for your future sustainability. So again, that's another challenge. And then of course, recruiting new trustees is the biggest challenge of all. And this was identified by the recent ACRE survey, which was published last year. So recruiting new trustees is a big challenge across the whole country, and not just for village halls, it's for all charities. And the other one is loss of revenue. You've got to re-engage with your user groups and try and get that level of income back to what it was before. Next page, please, Skye. Right, this is what we want to move away from, being the lockdown image. As I've said already, some halls did not open at all, haven't opened since last March. So it's going to be an even bigger challenge for them to work through all of the ACRE information sheet and the appendices. It's going to be new to you if you haven't reopened, but now is the time to plan and, you know, hopefully get back to normal. And trustees, if you delay it, but legally you are allowed to be open, there could be implications with your insurance if you choose to remain closed. And also with the Charity Commission, because please bear in mind that if you're a charitable hall, it's your duty of care to put the best interests of the charity first and for your beneficiaries, who are the local community. So if you decide not to open, you are not actually working in the best interests of the charity. You could actually be in breach of trust. So it's a case of having to face working through all of these steps and things that you've got to put into place to make your venue COVID secure. Otherwise, you know, your local community are going to suffer at a time when they need to socialise. Yeah. Next page, please. Right, so the two things that you have to look at is how to prepare for reopening. Basically, two essential aspects. First of all, you've got to make sure that you are COVID-19 secure before you can open. So that's your first thing that you need to do, following information sheet 10 and all of the appendices, step by step. And the second part is to know what activities can take place legally at each of the 4 steps to reopening. And the key appendices for knowing what the key activities are, you need to refer to Appendix D. That's been updated on the 22nd of April. And I think the changes have been highlighted at the beginning of the latest information sheet. So you do actually know what issues have been slightly amended. But what the new addition is to the Appendix 9 and now 10 is the activities table. That's also slightly been updated as well. So hopefully you've all accessed those and been able to start looking at those and making sense of those. Right, so the next page, please. This is just to show you how complex it has been for ACRE to interpret all of the government regulations. So they're not just looking at one set of regulations that said this is for community facilities. They've had to, there's one for multi-purpose community facilities. They've had to extract information from all of those other bullet points. And it's involved 5 different government departments at least. So to extract all of the different relevant bits, whether it's to do with business support, the grants that are available, or whether it's to do with sport, whether it's to do with entertainment, whether it's to do with education and out-of-school settings, whether it's to do with retail, all of that information has been in separate documents issued by different departments. So it's been quite a task for ACRE to extract all the relevant bits and put it in one document. So it just shows the complexities of all of that. So next slide, Skye, please. The key message still is, if your really basic starting point, if you are concerned, it's still getting these safety measures in place and implemented into your hall. So last year there was a lot of promotion about hands, face, face, and that still is relevant, but now there have been new logos that come out, and if you want to have any of these printed off, I've got access to these from the Public Health England website, or you can sign up yourself and get any of these posters from the Public Health England website on a regular basis. So that is the overarching message. Obviously, we're coming into summer months soon, so when we're allowed to have the indoor activities, it's not really going to be a problem to have windows and doors open to let that fresh air through. But going into the autumn and winter, depending on the COVID situation, then you still have to be very aware that ventilation and fresh air is going to be something that you've got to take into account. Next page, please, Skye. So for those of you that haven't opened, you may not be familiar with all of the appendices that go with the Village Hall information sheet. But you do need to go through these, otherwise I don't think you're going to become COVID secure to the level that perhaps your insurance company would be happy with. Some of these have been updated, so even if you did reopen and you are familiar with these, we do recommend that you keep revisiting and make sure that you are still complying with them as they have been updated. Now, if you go on our website, you can freely download all of these, and at the side of each one, it says the date when it was last updated. So if you know that the one that you've got is a previous one, then, have a look at it again. You may not need to download it, but you might identify and realise what has changed, and you need to then act on that. But it is quite a task, to be honest, to go through them all, but I can't see how you would cope with it otherwise. I think D is the key one, managing of social distancing, a risk-based approach, and that activities list is something that will really, really help you the most. Right, next slide, please, Skye. So if you haven't reopened, this obviously Appendix A is the one that you need to start with. Work through all of the checklist. So basic things like informing the hall insurer that you're planning to reopen. Check your security codes and key logs about the security of the hall. Make sure that you have implemented the special conditions of hire, and that is in a separate, that's Appendix E, so you don't have to invent it yourself, but we do recommend that you do use the special conditions of hire. Otherwise, your hirers are not going to know what's required of them. Extra cleaning requirements. You've got to work out what, when, what have you got to do, what extra equipment you may need to purchase. PPE, of course, you've got to make sure that your water system is safe, flush through because of the risk of Legionella. There's more information that you can find online about that as well, but at least with the checklist, you know that you've actually got to do it. Obviously, you have to do health and safety checklists anyway, but if you've been closed for a long period of time, that is a good time to review your routine health and safety, and obviously fire safety risk assessment. So all of these are the basic things, but they are crucial as you plan to reopen. You're going to need extra hand washing facilities and hand gels at entrance points and things like that. Manage social distancing through the signage, floor markings, etc. But each village hall is different. So again, you've got to work out what is applicable for your hall. And a designated safe space, that is if somebody becomes ill while they're actually at the premises. It's identifying somewhere on the within the hall where you can sit somebody away from the rest of the attendees. So all of that information is in the information sheet anyway, but that's just an example of the checklist that you need to work through to start with. Next slide, please. Right, obviously this is the 4 steps. Step 1, we've obviously gone through all of that, but each step builds upon the previous step. So to understand what was allowed at step 1 is quite useful, because when you come to step 2, then step 2 is in addition to step 1, if you see what I mean. So I think we're probably all fully aware. These are not specific just for village halls. These are the generic steps for the public. So it includes things like outdoor sports, organised outdoor sports, about travel, domestic or international travel. So this is for everybody. So you would just look at these and extract the bits that would be relevant to a community building. So obviously the rule of 6 was introduced again at this stage. And now it includes rule of 6 or 2 households, and it's outdoors. And that still applies at the moment as well. So I'm not going to go through each of those, but we will make these slides available and you can look back through these when you get a chance to read them. But we've passed through that phase now and we're in step 2. So we'll go to the next slide. So this is 12. Okay. So when you're preparing, again, this is crucial and this is essential to do the risk assessments, and especially for insurance purposes as well. These will be required if there was anything that did go wrong and you were challenged in any way. But the fact that they are templates and all the questions are there are set out for you, you would be very negligent if you didn't actually go through these processes. So you can download them from the website. Appendix F is a sample COVID risk assessment for the hall trustees or the hall managers. And then Appendix G is to be given to each of the hirers. And it's for them to go through to make sure that them as the event organizer or a hirer, that they know what things that they've got to, what measures they've got to put in place. In the same way as the special conditions of hire, because again, they've got to know what they're signing up for when they hire the hall. It'll all be explained in those. I'm not going to go through all of the details. It would take us probably a week to go through all of these things. But as long as you're aware of the ones that are crucially important. And the way that it's worked out is the typical risk assessment process of red, orange, green, or high risk, medium risk, low risk. So anything that's on that template that's highlighted in red, these are mandatory actions that you need to implement. And as I said before, your insurance company would expect you have got, as a minimum, you have got to make sure that you've complied with those red actions. Orange actions are strongly recommended, and green actions that you might like to consider. But like any risk assessment, you would try, hopefully, to address all of those actions if you can. It's F and G have recently been updated to reflect the new rule of 6 or 2 households. And there's a removal of information about the shielding and vulnerable groups being advised to stay at home, because the stay at home regulations have been lifted now. So that's no longer relevant. So the only change, I think, to Appendix F and G are what it says there. It's some of the terminology on the social distancing, the rule of 6 and households, and the fact that people are not required to stay at home and they're not shielding. So that explains the changes. Next slide, Skye, please. So I've just put in a few slides as we go through the presentation, just to illustrate some of the issues that people ask about, so the questions. And one of the common things that's cropped up time and time again is this issue of the support groups. Now, if you remember back to even in the lockdown, halls were able to open for certain things. And one of the things was for support groups, and it did cause a bit of confusion what that meant. But it still applies, support groups in 1 and 2. At step 3, they'll be open anyway. So there's no need to have this special exemption for support groups. But they are groups that have to be delivered in person rather than, say, over a Zoom meeting. So they have to be done in person. Up to 15 people, and they have to be formally organised by a business, charitable, benevolent or philanthropic institution or a public body, statutory body, to provide mutual aid, therapy or any other form of support to its members or those who attend. So the type of things are mainly around health. So things like victim support, domestic abuse, people with addictions, alcohol, narcotics, substance abuse, rehabilitation of offenders or pre and postnatal support groups, stroke club, dementia support, LGBT issues, bereavement, vulnerable young people. So that you can see what it means by a support group. It's not a WI or a coffee morning. A coffee morning is not a support group. So that's just to illustrate what that means. So we're in step 2. So they are allowed to meet inside. So that at least you'll know what groups are allowed to meet inside. When it gets to step 3 at the 17th of May, that's not going to be so much an issue, because people can meet inside at step 3. Another one that's cropped up a lot is about weight loss groups. And it's a bit of a maybe sort of, are they a support group? It's a health related issue, but there's been a lot of debate about this at ACRE, and they think it is doubtful. And given that members may inherently be vulnerable if they are overweight, perhaps they are not run as a support group. Slimming World or Weight Watchers, for example, Slimming World recommend that weighing and one-to-one support would be allowed inside the hall. But then if there was a meeting afterwards, that would not be allowed. That would be carried out maybe online if they still wanted to have that social element. But one-to-one up to step 3. And again, any type of group, so people like Slimming World, Weight Watchers would have a national organisation. So these groups need to seek advice also from their national governing bodies. Next slide, please, Skye. So step 2, obviously that started from the 12th of April. And a lot more activities were still allowed, but mainly outdoors. So the rule of 6 or 2 households outdoors. No household mixing indoors, so applies also, inside a hall. Now it says indoor leisure gyms can open, but I believe that's just one-to-one individual training. So again, one-to-one individual training would be allowed inside the hall, but no more than you know, no more than 2 household groups. It has to be a single household group or a single person. So it's saying here libraries and community centres can open, but it's still for very limited activities. You may have some business operating from your hall. So if you had, say, for example, it's been used by a local hairdresser, or just during these special circumstances, that is allowed, because it's they are allowed to open. All retail is allowed to open. Markets, charity shops can open, things like that. But any sort of retail that you had in the hall before, that is allowed. Outdoor hospitality, we'll talk a little bit more about that, because there's a few changes about that. Obviously, indoor parent and child groups have been allowed up to 15 people, excluding under 5s. Okay, accommodation doesn't apply. And there's been a change to this one here about the funerals and the wedding receptions, which I'll cover in a minute. And that's an interesting one about the event pilots. I don't know if you're aware that during April and May, the government have been piloting some gatherings and social events and concerts, and I think things like the World Snooker Championships, events like that. They're all on a pilot scheme, so the government will have time to run those events and see what the fallout is. If there's an increase in, they will obviously trace and follow the people that attended to see if there's been an increase in cases of COVID. Once they get the results from that, they can then go on to the next stage, or decide what to do at step 4, whether we can be fully open, no social distancing, and back to normal. So that's interesting. That is going on currently. So the next page. This talks a little bit about the rule of 6, which is still outdoors, and it's slightly different from last year's rule of 6. If you remember back to last autumn, the rule of 6 was introduced, but it now includes or the 2 households. So you could have more people, in theory, seen out and about together. If they are 2 households of, say, 2 households of 4 people, it is allowed to have 8 people in a group. Or if the 2 households of 5 people, 10 people are allowed, and that is legal. So that's slightly different. If people in a group of 6 are not from the same household, though, they should still social distance. So you can have a group of people, but they should still be that 2 meters away from each other wherever possible. So just to be aware of that. There are things like households, there are the support bubbles, or there are linked households, which is to do with 2 single parent families getting together. So there are variations to it as well, but it's all explained in the Appendix D on what's allowed with social distancing rules. Right, next page then. Right, so this is going to talk now, the next few slides are going to talk about what has changed slightly, what has been tweaked since, I think, well, the Village Hall Information Sheet 8, and maybe some changes from the 9th one as well. Okay, so changes to test and trace. Previously, if you develop COVID-19 symptoms within 10 days of visiting these premises, people were required to alert the NHS Test and Trace. Now, this paragraph was in the special conditions of hire, but it's just good to understand what the differences are. So hirers had to be aware of that they would then have to alert the hall cleaner to tell them that somebody had developed the symptoms that had attended their event. Alert the organiser of the activity you attended. You must seek a COVID-19 antigen test. So that's what it was previously. Now, what they're saying, if you develop COVID-19 symptoms within 10 days of visiting these premises, you must seek a COVID-19 test. The difference there is you're not having to alert NHS Test and Trace unless it's a positive result from the test. So it's quite a significant difference, and that's been reflected in the special conditions of hire. So the government are wanting people to have regular tests, but please, you don't have to notify NHS Test and Trace unless it's a positive. So that's quite a bit of a change there. So if you've got people who, when they come onto your premises, they are meant to give their details or scan the QR code. If they refuse to give their details, contact details for the test and trace reasons, and if they refuse, that's okay if it's just normal village hall activity, but if it's a hospitality activity, like a community cafe, the premises could be at risk of £1,000 fixed penalty fine. So I'll talk about that in a minute. So it is important that attendees are fully aware of their responsibilities under the test and trace scheme. And that's also reflected on the Appendix C poster. This has been changed on the poster as well. Right. Next slide, please, Skye. Again, this is another Public Health England poster that's a recent one that's just come out. And it's saying that now, because there are these, increasing free rapid COVID-19 tests, they're advertising it everywhere at the moment. And they're very easy to get hold of. So, and this is going to be a way of reopening in the future. So when your hall's got events, we're not quite sure yet how it's going to work. We don't know if there's going to be a vaccination certificate. So if you were holding an event or a concert, for example, and if it became a requirement that everybody has to have a certificate, a vaccination certificate before they can attend your venue, we don't know yet whether that's going to happen. But if not, it may be that halls maybe have to ask, well, have you had a recent test, COVID test? So it's going to become more important as we move forward in society. We're going to become more accustomed to perhaps being asked these questions or being required to have the tests. There has been a certification review in March. The government did do a review on whether a vaccine certification is going to work or not, but they've not announced the results of that review yet. ACRE did respond and did put some comments to that and how it may affect village halls. So I've got to wait and see what happens there. And it may be that if there's no actual certification, but if somebody hasn't had a vaccination, it's useful maybe for the hall to know, if the person's willing to tell you, they may be asked to sit a little bit further away from the rest of the attendees. Or if you know there's somebody who is vulnerable, or people over the age of 70, for example, and there's somebody that's not had the vaccination, you might sort of expect the event organizer to seat that person a little bit further away from the rest of the group. So we don't know yet how that's going to work. But these free rapid COVID-19 tests are definitely not for people with the COVID-19 symptoms. This is just for general public, just to have this test, not with symptoms. I think 1 in 3 people that have got COVID don't show any symptoms whatsoever. So that's quite worrying. Right, okay. There are various places as well. I don't know whether you're aware. I think each local authority area, they have somewhere where you can actually go along and get these tests. And also you can go along and collect free tests that you can do at home as well. So you can either pick it up from a community testing centre, You can order them from a government website, and I think Derbyshire County Council have got some mobile centres moving around the county, and it's all available on the Derbyshire County Council website if you want to know if there's going to be one in your area. But that's a good way of accessing them. Maybe if you live in a rural area and you're not anywhere near the one testing site in your local authority area, then a mobile way of accessing those tests is going to be really helpful. It's all on the County Council website, so please do visit that, because that information is useful to get across to your hirers or people in your community as well. So next page, please, Skye. Right, QR code. This has slightly changed. When you read about the differences or what hospitality means, a hospitality venue is if your hall, well, it's things like obviously cafes, restaurants, hotels, that is a hospitality venue, but how does that apply to halls? So if your hall has got a community cafe, it may have an official bar, you might have a social club at your and the way I look at it, I see it's more like it's somewhere open to the public. So it's not like a discrete group of people having a meeting and sitting down as a social and having a cup of coffee and saying, well, we are a hospitality venue. That isn't what it is. A hospitality venue is more perhaps where your cafe is open for anybody to attend. So the rules there are slightly different. And it's useful. You've got to, you know, if your hall has any of these, you need to be aware of these differences. So if somebody's running a community cafe, for example, the organizer is required to record everybody, each individual on arrival, and that could either be through the NHS QR poster or another mechanism to take contact details on arrival. So somebody writing their name and contact details down. Now it says new NHS QR poster. I believe there is, it must be in a different format. So if you had one previously, you do need to download what they call the new NHS QR poster for hospitality venues. But if your hall hasn't got any of those cafes, bars, social clubs, etc., you are still legally required to display a QR poster. You can keep the one that you've already got because it's not a new poster, it's the same poster. Even if your Wi-Fi is really, really poor, you're better to cover yourselves, because I think it's a legal requirement to have a poster. So even if you know it's not going to work, it might be advisable to download one. That's my suggestion anyway. It's the responsibility, however, not of the trustees or the hall managers, it's responsibility to record the contact details by the event organizer or the hirer, same thing. We're classing any hiring as an event. So an event organizer. This is explained in the special conditions when they hire the hall. So they can't turn around and say, we didn't know we had to do this, because they've been given the special conditions of hire. They've been told to carefully read through them and to ensure that they understand it and that they will implement those special conditions. That's crucially important to be aware of as trustees. If you feel that they're not going to comply, you can refuse their booking. I think it's definitely, they've got to take this seriously. The hirer is equally responsible and they've got to know what their responsibilities are. Not every venue has somebody on site all the time. You know, little village halls haven't got a trustee on site or a manager on site. Maybe different in a big community centre or a town hall, but the majority are small halls, and the only person on site at that one time is the person organising the event. So they are totally responsible for the COVID safety of their attendees. So the special conditions of hire, which we'll talk about later, are extremely important to understand. So, the hirer, they must ensure that the people attending their event either use the QR code or they take a record of people. Either they may take pre-bookings where they've got people's names and email addresses and telephone numbers before the event. If not, it's somebody writing it down as they arrive and come through the door. But it's their responsibility to keep that. And I think they have to keep it for 21, keep it safely, that information, keep it for 21 days after the event in case somebody does develop the symptoms. But then they can destroy it. They shouldn't keep people's contact details longer than that because of the GDPR regulations and personal data restrictions. So I hope that makes sense. Now, it says attendees over the age of 16, that's what it says in the ACRE information sheet. I'm assuming, and I'm not sure whether that is the same for the hospitality venue, because I no doubt you're going to ask, does it apply for hospitality venues as well? I'm not 100% sure. I would think it probably does apply to both, but it would be worth checking if you do have a hospitality venue on the age limit. Okay. So next one, please, Skye. Again, one of these very pretty Public Health England posters. Again, this is talking about hospitality, cafe, bar, social clubs. Groups of 6 people sitting outside will be able to enjoy table service at outdoor hospitality venues. I haven't been out yet, but I'm actually going out tonight, and I think it'll be very cold. I'll be sitting outside. So I'm hoping that there's perhaps some sort of heating outdoors. So I'm looking forward to my first venture out to a hospitality setting tonight. But the important thing there is that you're seated and that the food and the order and the food is done at the table. So people are not getting up and putting the order in at the bar. They have to be sat at the table and the food consumed at the table. Halls may have some sort of hospitality. I doubt whether cafes and things will be in the evening, but if you've got a community cafe, then you have to follow those principles. People sat at the table. Previously, there was a curfew on serving food and drinks at 10 o'clock in the evening, but that's now been lifted. So that's a slight different change to the regulations. So next slide, please. So the other changes to those hospitality venues. So steps 2 and 3, food and drink still to be consumed at tables. So even up to the 21st of June, then people will be expected to consume food at a table. And as I've said already, the 10 p.m. curfew is now lifted. A few tweaks: if the venue sells alcohol, again, all food and drink must be ordered, served and consumed at a table. So they're not getting up to the bar. Or if sale of alcohol is not offered, which might be more applicable to Village Hall, customers must still be seated when consuming food and drink, but they can order and collect food and drink from a counter. It all seems a bit complex, but once you work out what your particular hall is it a hospitality venue? Do you or don't you serve alcohol? You can work it out there. Or if the venue at step 3, which is from the 17th of May, if you are a cinema, so you may have film clubs in your hall, or any sort of theatre, concert hall, or sports ground, then customers with a ticket to the event are able to collect food and drink, including alcoholic drinks, to consume at their seats rather than having to be served at a table. So that's easing a bit of the restrictions from step 3. Again, this is all in the latest information sheet. So, and you will get copies of the slides as well. But this is just to highlight the key things that are changing. So next slide. So the other thing, again, to point out, there's a difference obviously between wedding ceremonies and holding a wedding reception. This has caused a little bit of confusion. So ceremonies, it does say on those step posters, step 2 up to 15 people, step 3 up to 30. What has changed though, the exemption allowing wedding receptions indoors at step 2 was withdrawn. And I think it may still, if you go back to that step 2 poster, you know, that where it showed you all those little icons on, it probably still says that they're allowed, because that's not been updated. We've only got a couple more weeks of step 2 anyway, haven't we? We haven't got long to go to the 17th of May, so it probably isn't going to affect any of you, unless you had got weddings planned during April and halfway through May. But they weren't allowed to have the weddings indoors, but they could hold them outdoors. So if there was a marquee or a gazebo with the sides open, 2 sides open, then they could have 15 people attending, and then 30. It's going back to what the regulations had previously said. From the 17th of May, 30 people can attend the reception indoors. So it's almost like back to what they originally had announced, the regulations had announced. So that's all for the first session. So we'll have coffee break. Are there any outstanding questions, Skye, that came up in the chat?
Let me just have a look. I think there's a few. Give me 2 seconds.
I did see 1 or 2 cropping up, but I didn't get a chance to read them. I don't know if I can access.
Someone's asked if a COVID-19 test the same as a lateral flow.
I think so. I'm not completely au fait with the terminology with these tests. I think it is the same thing. A lateral flow, I think, is one of these quick tests. I think that is different to if you've got the COVID symptoms. I'm not sure actually, but I think it's just another terminology for it. Does anybody know otherwise? Does anybody, an expert on
I think
COVID?
it's different. I think they say that the lateral flow's slightly less inaccurate, hence why if you've got symptoms, I think you have to go to the test centre and they do a different one. But the lateral one, you get the results back in 30 minutes.
That's the 30-minute one. So that's the one that I think they want the general public.
Yeah, you
regularly
can get the at-home kits as well for those ones as well.
Yeah, and that's just to give the government an idea of how much what's actually happening in local communities, and they can track different parts of the country if there's suddenly an outbreak. Obviously 1 in 3 that have got COVID, there's no symptoms, so this is probably the only way moving forward that they can keep track of that.
Yeah, and then page 16, surely the rule is if you develop symptoms, seek tests. What's the relevance of the within 10 days of visiting the premises?
So that again, Skye, sorry.
They've said that page 16, surely the rule is if you develop symptoms, seek a test. What's the relevance of the within 10 days of visiting premises? It was asked by Janet.
Yeah, because I don't know how long it takes to incubate the virus, so that must be what they consider. You may be infectious before you get the symptoms. So if you've been at a venue, you could have been infectious, couldn't you? And then develop the symptoms 10 days later. So you may have passed it on to those other attendees without knowing. I think that's, they obviously, the government think that 10 days is the appropriate time. perhaps it's being on the cautious side. Perhaps, 10 days is cautious, but they have to be cautious, don't they? That's all I can assume.
Sorry, you've missed the point, really. If you get symptoms, you need to seek a test, irrespective of where you've been. Then the test and trace system takes over the recording of where you've been and how to report you.
Yes, so that's another way of looking at it. Yes, you're right, Janet. Yeah.
And then page 18, what if the hall is not a hospitality venue, but the hirer is organising a hospitality event, say a tea party? Whose responsibility is the test and trace?
Okay, it would not be clear if it's a hirer that's having a function. So it's not open to the public, I'm guessing, is it? So if it's a hirer, it's their responsibility to do the test and trace and make sure that everybody that's attending, because they've signed a contract. When you sign a hiring agreement, you're signing a contract to say that I have read the special terms and conditions, I agree with those, and it's up to that hirer then to implement them. So it's their responsibility as a hirer, but they need to be fully aware of what their responsibilities are. I think there will be slight grey areas, but I mean, I think as long as the system, if it's a hirer, I would say that the hirer is responsible. Because if it's a hospitality venue, say it's a community cafe, they're not, whoever's managing the community cafe, it may not be the trustees, it may be another group of volunteers, but they may have something like an occupational license or something to say, we're going to occupy that part of your hall to run a community cafe. Now that's a different situation, but they would be responsible, whoever is organising the event, or the business that's running the community cafe, or the person running the bar, the business running the bar would be responsible.
And then also one last question is there pressure on reopening on May the 17th, or can we wait until the 21st of June, by which time rules will have changed and risk assessments will have changed again?
I think it is down to trustees. I think you've got to also, though, look at the best interests of the charity and of your beneficiaries. So say if there's a big community need, say the people in your village are desperate to get out and socialise again, and the village hall is the only place that they can do that. I think you've got to weigh up the needs of your communities, because they are your beneficiaries, because you as trustees are acting on behalf of your beneficiaries, which is the local community. So I think by refusing to open, or too scared, too cautious to open, you've got to weigh that up against, are you acting in the best interest of the charity? And if you are perhaps delaying it, ask yourselves, well, why? What is it that we are anxious about? Because you can only act now on the information that's available now. So even if it changes in the future, and something you might think, well, we didn't know those new regulations. Well, you can't know what's going to happen in the future. We can't predict what's going to happen in the future. You can only act on what the regulations are now. And I think if there's anything going to change, it will only be slightly. Those last few slides that we've just gone through, they're only actually quite minor changes. The key things that you need to be focusing on are your risk assessments, making sure that you've got all the measures in place, doing your reopening checklist, make sure you've got special conditions of hire, that you're providing all the safety measures that you were required to do. So if there are any slight changes in the coming months, they're not going to be major. So, and if you delay it, then you've still got to go through all of this process a couple of months down the line. It's going to be just as difficult then to face as it is now. So I think we would recommend that you don't keep putting it off, because you're going to have to face it at some stage, and you can only act on the information that is available now, and don't worry about the future so much. I mean, you've had all this funding through, well, hopefully you've got access to the business support grants. They are there for you to get back, not there as a comfort blanket. They are there for you to hopefully for you to reopen as well. So if there are extra costs involved with reopening, maybe you've had to install extra hand sanitizers and, you know, pay for new things here, there and everywhere. Those grants were there. That was what that was money was there for. It was not money for, oh, we'll put that into the new boiler fund, or we'll you know, when we re-roof the hall. Really, that funding was to help you through the COVID related issues.
Can I just say, Helena, because I asked the question. We've already gone through all the COVID assessment last year, because we were going to open September, October time, and then events overtook us with the changes again, and we didn't. But what we found was we did a questionnaire, and we found that people didn't want to return anyway. We're about to do another questionnaire to see what people feel like about it in the village and among the hirers, and to see and go with the feel, because that's obviously been a key thing. I'm quite happy to look at our risk assessment and our hirers agreement again and do it again now. But I'm just wondering that if we ultimately don't open until June because there isn't the willingness for people to come, how much I'll have to do it all again because things will change drastically. And it's that just, I don't have a problem with keep doing it, but I just wondered whether or not there is pressure on us to open or not. Because in May, I don't think we've still got that. We're still not able to do the sorts of things in the May description where we can be a proper community, where people we know are going to want to greet each other and hug each other if we're not careful. Whereas they may feel more inclined, and it may be allowed more in June. So I think it's quite an interesting point we're at the moment. You know?
It is. Again, that goes back to what the needs of the community are, Zena. I think it's a two-way process, isn't it, really? It's no point being open if nobody's going to use the hall. But I think if you're going to do that research, find out what the community, you know, where they're at, what their feeling is. But from May the 17th, an awful lot can happen in halls. So all groups that were then using the hall beforehand can start meeting indoors. So WIs and, you know, history groups, all your groups that were regular users can start using the hall again from that date. So, you know, it's still following the COVID rules. You know, perhaps indoor masks still may be required, but the little things that change may be simple things like, well, you don't have to wear a mask anymore inside. But that's not really affecting all the things that you've done to prepare to open. It's just maybe a small tweak. And again, we don't know about the vaccination certificates moving forward. So we can't plan for that anyway. We've just got to suck it and see what's going to happen. But I mean, each hall has to weigh up what their capacity is, what the needs of their local community are, what the situation is. But a lot actually can happen from the 17th of May. So don't be afraid of actually opening up and inviting your user groups back to the hall again. So I suppose in a way, now is the time for any hall to actually get that message across to their old user groups and to the community. You know, we're going to be open from the 17th of May. You know, groups can come inside. Oh yes, you're still going to stick with the rule of 6, but at least you can get together, you can get out of your house. You know, older people can, you know, lunch clubs can meet up again, coffee mornings. You know, there's a huge community need for that social interaction to get back to normal again. It'll be slightly different, but I think that's manageable. So again, it's down to you as individual halls, what you feel you can cope with. But I think it's weighing up what the needs of your beneficiaries are as well.
Well, we've been waiting with perspex screens and sanitisers since last September. We've not been able to manage to do it. So we have done all the preparation. It's just
gosh,
been frustrating, really, the way it's fallen. So anyway, thank you for that. That was helpful.
Okay, right. Well, it's just gone 11. So shall we have a 10-minute break? So if you can put your mutes on, so we're not hearing your kettles boiling and your dogs barking in the background. And we'll join back again, we'll say 15:15. Okay, thank you. Yeah, running a building that is largely for yoga, Pilates classes and other rooms. So it's your own private business.
It is, yes.
And presumably the people, the therapists, they're all businesses, aren't they? So it's not classed as community use in that sense.
No, so Yeah, sorry, go on.
Any of the regulations would have to be for the for businesses. So I don't know whether you've checked online.
No, I haven't. I mean, I've pieced together things and spoken to the therapists involved, acupuncture, clinical psychologists, and what have you. And we've, on the checklist that I've just been looking at, that you showed us, I'm thinking, no, we're all right. We're doing
Yeah.
okay, but I've done it piecemeal because I didn't know, I was just looking at the government website and finding things that were helpful. My main concern is that is just this use of the toilet and how I can make it safe for people. We've managed to be safely open for the last 9 months. And now just introducing big groups of people, relatively big groups, 7. It's just advice that you can give people without, well, I suppose we do need to be quite prescriptive actually, and say this is what needs to happen.
Yeah, I think that's true. Yeah, I think it may be providing the materials, the right signage, and making sure that your hirers, your businesses, know what the regulations are. So it may be that, staggering times and things like that.
Yeah.
Queuing, one-way systems, it depends on the layout, but it's the same principles as a community building, even though there may be posters and things that would be suitable for work premises. So it may be just Google COVID posters relevant for work related, office spaces, something like that.
That's a good idea. That's a good idea.
And if I can have a look on I'm signed up to the Public Health England posters and things that have come out. I've used them in the presentation a lot today. I can have a look if there's anything that's office based that might help you then.
That would be brilliant. Thank you very much.
Okay.
That's great.
Right. Okay. Are we all getting back? I've made a coffee. I've not had a chance to drink it. I live on a farm and I've been making coffees and things and running outside with the men's coffees, not my own.
Helena, I don't know if you hear me. It's Jackie.
Yes, Jackie.
It's just our church group. I'm a bit confused about the inside and the rule of 6 and how to implement that on the May the 17th, because they've not been back as yet. We are open, but we've not had groups of adults as yet inside. So I think my understanding is the church could go in, but they've got to have like families, groups of 6. Is that right? Within the community centre. So, and then giving them adequate space with lots of groups of 6.
The rule of 6, they don't have to be from the same household. There's 2 options in the rule in the new social distancing. So the rule of 6 means that it can be 6 people from different households can form a group, but because they're from different households, they should still be socially distanced if they can be 2 meters apart. But they can, if you've got an event at a hall, for example, say it's a craft event and you've got people sat at tables, you could have 6 people sat in one table, 6 people sat at another table. They could be from different households within the groups, but they don't get up and mingle. They stay within that group. So even when they're going to, say, the toilet, they've got to sort of be careful that they're not people from different tables getting up at the same time so that they could get near each other, if you see what I mean. They're meant to be completely separate from the other group of 6, if that makes sense. I don't know specifically for churches, but church halls would be applied just the same as a village hall, the same regulations. But I think there's some slides on the rule of 6 maybe coming up. So we can cover
it's just
that.
like we could obviously the whole capacity we've got is probably about 120, and if I think you talked about rule of halving it, and it's just like how many people could they bring 50 in?
Depends on the size of your room. If you go into the information sheet, it'll tell you how to work out the COVID capacity. I don't know off the top of my head. There's also, and you can download this from our website. I don't know if you can see it.
Yeah.
It's a document called COVID Sofa Community Centres. And it's been published, ACRE half funded it with a company called If Do, I think they're architects. And this was published last year. And it sets out everything to do with social distancing and how you can, it's got graphic design, you know, showing you how it can actually work in practice. So how you can manage the flow of people going in a building, accessing kitchens and toilets, and then coming out of the building. So
Right.
I would go on our website and download that.
Okay, thank you.
Could I just ask on that? Two questions. One is that about face masks and when they have to be worn. Is it only when you can't maintain 1 metre from each other? But the other one, just going back to the number that you can have in a hall. If you have groups of 6, they can obviously be next door to each other. How then do you decide how many the hall can fit? Because if you have 5 groups of a bubble of 6, you can get 30. But if there are 30 from individual houses, then you have to keep 2 metres apart.
Yeah,
So
that's
how we do all that, to be quite honest.
well, I would stick by the COVID capacity. If you know the size of your room, and allowing the 2 metre distance, regardless of whether they're a household group or not, I would go
Right.
on that basis and stick by that number. So you've worked out a COVID capacity for your hall, stick with that, and then work out, as you rightly say, if it's a group of 6 people from different households, as much as possible, they should still maintain that 2 metre social distance. So you need to know what your capacity is, and then allow so many groups of 6 in. It gets complicated because you might say, okay, yeah, but then we've got 2 family groups coming in and they can sit next to each other. They don't have to social distance. Well, it's going to get too complicated to manage it, I think. Just, I would work out your 2 metres capacity, your COVID capacity, and I would stick with that. It's still a requirement, government requirement, to wear masks inside. The only reason that you can take the mask off is if you are consuming food or drink. So when you're, even if you're in groups of 6, or, you know, it's still face masks inside at the moment.
Right. Would that be after May as well, can I ask? At the moment, it will be, will it?
We don't know, so we've got to assume that it will be. We don't know. It hasn't been said otherwise. These are the slight changes that we can't predict.
Because I think from our point of view, that is what
right,
is...
let's get back to the sorry, I can't hear you, Stephen. Can you put it
Sorry,
in?
I was just going to say, I think that's what's putting some of our groups off, like the art groups. They don't want to sit in a building for 2 hours painting, but with a mask on. That's what they're finding.
Yeah, the regulations are what they are, unfortunately. Yeah. Right, with screen share, you should have the slides back up again then now. Right, I think, did we talk about wedding receptions? Yeah. Which we're on 22 now, aren't we? That's right. So just some more examples of what questions are being asked. Is that slide 22? Yep. Right. Can a dance instructor give one-to-one tuition to an individual or a household group from step 2, as in now? Yes, they can. In actual fact, UK Active, which is the national body for those sort of activities, say one-to-one coaching teaching is permitted from the 12th of April. The dance instructor is at work, so they're allowed to be working. So it's okay for the dance instructor to work inside, and it would also constitute, it is 2 households in a way. You've got the instructor, and then you've got it's one-to-one. So, but it is allowed inside because gyms are allowed from the 12th of April to do one-to-one training inside. So if it's okay in gyms, we interpret that it's okay in the community building as well. So that's been sanctioned by UK Active. Can outdoor exercise classes take place from the 29th of March? This is going back quite a long way now. So outdoor gatherings are permitted with the rule of 6. That's still ongoing. That still applies now. And outdoor organised grassroots sport can return. And the key word there is organised. It has to be a proper organised team or team sport to be taking place outside. Outdoor activity is safer than obviously indoors. So provided an exercise class is organised in accordance with the rule of 6, a larger number of people should be able to take part, plus following guidance from their EMD governing body. So what it's saying is, if it's organised sport outside, and if they can follow the rule of 6 as well, you can have quite a large group of people. It's not restricted to, say, 15 or 30, something like that. But again, they'd have to refer back to their governing body. I doubt village halls whether you are responsible for organising outdoor sport, but there may be playing fields attached to your hall, so it may be relevant for some of you. Next slide, Skye, please. So sport and exercise at village halls. At the moment, you are allowed to make your toilet facilities available. So if there's some activity happening outside on a neighbouring field, they can access your changing facilities, but only for use of toilets or first aid. But there is an exemption for disabled sports people. They would be presumably allowed to come and perhaps sit inside or change. It doesn't specify, but there is an exemption for disabled people. Non-team sports are allowed outside, not inside. Again, repeating what the last slide said, follow your governing body's guidance on how you should operate that team sport. Indoor games allowed for single households or a bubble. So if you've got a family of, say, 6 people who are desperate to go and, you know, have a game with ping pong or badminton in the hall, if it's a single household, there's no problem because they're not spreading the risk, the virus, because it's a single household. So that is okay. You can open the doors for those sort of activities. Indoor combat sports for adults, such as martial arts, can restart in phases from step 2, which is what we're under certain conditions. Again, they'd have to refer to their government guidance, refer to government guidance for grassroots sports. I think there are certain exemptions for combat sports. Don't ask me the reasons why, I don't know, but there are exemptions for those. Next slide, please, Skye. Okay, so this is the one really that people are concerned about. It's what's going to happen at the next step, 17th of May, in a couple of weeks' time. All of the steps, the government have said that 4 weeks, well, a week before the next step, so 4 weeks in and a week before the next, they are reviewing how it's all gone. So in a week's time, all the data, statistics will be reviewed by government, and in the week before the 17th, they will decide whether any changes need to be made. So asking about things like face masks, capacity limits, we don't know for sure. And I suppose Zena pointed that fact out earlier, that things may change. There'd only be slight changes. It could be a thing like a face mask. We can't presume that, but the government may make slight adjustments, but nothing major. So indoor entertainment and attractions, so things like performances, amateur and professional, will be allowed to take place from step 3. Now, if you look at that Appendix D, the activities table, all of those things are listed there. So do refer back to them. You'll know exactly when you can start these things. I think initially amateur performances were not going to be allowed until June. Now I think they're saying that amateur performances will be allowed from the 17th of May, following all the COVID guidelines and restrictions. Outdoor, it's gone from 15 to 30 person limit, and the rule of 6 or 2 households will apply indoors, and it does say subject to review. We don't know on that one. So sport, organised sport, indoor adult sport can move inside. Hospitality can move inside, so things like your coffee mornings, afternoon teas, community shops can go back indoors, still following the COVID rules, but rather than being outside, they can now come inside. The next one, it says most significant life events. We'll talk about that in a minute. It's interpreting what the government mean by most significant. So it's not all events can go back to normal. So that one says remaining outdoor entertainment and performances can go indoors, can happen. Again, where it says tickets at the bottom, most significant life events, up to 30 people. Yeah, I think we'll cover that in a minute because there's quite a few figures there. And then indoor events, it's talking about larger events up to 1,000 people, up to 4,000, and then very large stadiums. So not that is not going to be applicable for smaller venues. And as it says there, pilots are going to continue as well. But we will know more from what they've found out in April and the beginning of May about those capacity limits. So that's a good overview, and we'll go on to the next slide, please, Skye. So 126. Okay. So when it says most significant, what that means, things like weddings, and now the wedding receptions can take place inside. So that's reception, funerals and the wakes, christenings, bar mitzvahs, that sort of thing. But what they don't mean, you can't have dances, parties, so no teenage or adult birthday parties. So those 40th, 50th, 60th, 70th, 80th birthday parties that everybody's had to postpone or miss are still not going to be allowed at step 3. And we're assuming that that means anniversaries. So somebody's got a wedding anniversary, they're not going to be allowed, unfortunately, meaning a wedding, a funeral, a christening. Unless we hear otherwise. That's the information that we've got to abide by for now. So things like dances, dance floors and nightclubs are not permitted to open before step 4. So we have to follow those rules as community buildings. Loud music is still not permitted because people would then try to speak loudly to talk over the loud music, and then there's the risk of the aerosol transmission. Performers are advised not to encourage impromptu dancing by audiences. So even though a performance is allowed from the 17th of May, so say you've got a stage and people are sat as an audience watching an audience or a band play, the audience shouldn't get up and start dancing around or singing along to the music. So they've got to encourage, there should be people marshalling it to make sure that people don't get up impromptu dance or sing along. Should be no group singing by worshippers or audiences. Again, that's aerosol transmission that they're trying to avoid that. Places of worship, I don't know a great deal about that, but there's the information is out there, and they would have to look at the government guidance for performing arts, because there will be a specific bit on their section to deal with places of worship, but I've not studied that bit. So if you have got a show or a performance and people on a stage, for example, I think you're allowed up to 50% capacity of the hall because people will be seated in rows. So it'll be slightly different. So the regulation allows more people in to a performance or a film show, a film club. Again, refer to Appendix D. All that information is in there, and the activities table as well. Next slide, please, Skye. Right, as we said, more information will be released as we approach the next step and step 4, but it's always best to take that cautious approach. Go by what the regulations are now, plan for that, rather than think and anticipate what might happen, what might change. So going back to the working out your capacity, I think it's usually based on about 20%, 25% of your normal capacity to work out what your COVID secure capacity would be. But if it's an organised performance, I think it's then allowed to be up to the 50%. So what does up to 50% mean for controlled indoor events from the 17th of May? It appears that events and activities organised by a business, so again, it has to be a formally organised event, can be held within the COVID secure capacity limits of a hall, i.e. socially distanced, and that controlled performance events, when they're seated in rows, might be permitted with up to 50% capacity. I think that again is, we've got to assume we can work towards that, but again we have to wait for any announcements coming up to step 3 if they're going to change it. Right, next page please, Skye. Well, that's just a picture, nothing really. It's just a picture that was taken in the first, as we came out the first lockdown, of Tansley Village Hall. And that's ladies working at a craft there, a lace making group. And of course, that was 2 meters socially distanced. Of course, that could be different now because the rule of 6 applies. So you could, in effect, have one big table with 6 people sat around, and it would still be legal. But if you've got the capacity to have individual tables and be 2 meters social distance, that would still be the best approach. So you've always got to look what is the safest, not necessarily what is allowed. That looks safer to me than having 6 people sat round a table. So I think approach it like that. What is the safest way to approach things? Next slide, please. Right, here we're explaining a little bit about the rule of 6 that was the question arose. So how does the rule of 6 work at step 3? For example, for a craft class, like we've just shown on the Tansley image, I had an inquiry about this sort of situation prior to the session this morning, so hopefully this will answer the question. So it would be okay to have 6 people, for example, sat round a table, but as long as they do not mingle or mix with any other group of 6 people or any other individuals. So that's the key thing, it's the mingling or the mixing. So once they're on the premises, the idea is that those 6 people in the rule of 6 only really get close-ish, ideally 2 meters apart, but not so necessary. But they're not actually getting near other groups of 6 people, if that makes sense. So the groups of 6 also, as a minimum, need to be 2 meters apart. But if you've got a big room, why not spread them out much further than that? It would do the sensible thing, do the safe thing that's appropriate for your hall. It says unless people are seated back to back, but if you've got room to spread out, put those tables much further apart. It makes sense, doesn't it? Avoid any sharing of equipment between groups of 6. So it's ideally if people bring their own utensils and things that they're going to need for that particular craft. it's not good to share, you know, say, for example, scissors and pass it around from one table to the next table to the next. You know, the event organizer, if they're providing the equipment, as opposed to people bringing their own, then they should think that out in advance, that they need to have enough of each bit of equipment for each group of 6 that is going to be attending. But that's their responsibility to do that. Okay, next slide, please. Right, so we're on to step 4, 21st of June. My son's wedding was planned for the 19th of June, so we were quite miffed when Boris announced the 4 steps, because he's missed out on his wedding by 2 days. So step 4 has a resonance with us. Why didn't he bring it forward 2 days and would have been okay? But no, he didn't. Anyway, so step 4, which we're all dying for, we're waiting for, you know, June to arrive. Again, they will review it before they sanction step 4 to go ahead. So the week before, they'll look at all the data, and they're saying it's no earlier than the 21st of June. Of course, things in this country seem to be going the right way, you know, but obviously in other parts of the world, there are new variants, and, you know, India's suffering badly at the moment. You know, things can change rapidly, and we don't know, the government don't know what's going to happen. But taking this very cautious approach, not raising expectations by saying this is definitely going to happen on that date, I think is very wise. They're reviewing each step the week before, any tweaks that they need to make. You know, it seems a sensible way to do it. So at this magic date, if it goes ahead, no legal limit, subject to review. Dancing will be allowed, including nightclubs, again, subject to review. And again, larger events, concerts, festivals and things, again, they're looking at that. International travel, yet we don't know. And then no legal limit on life events. So weddings, funerals, wakes and things like that, anniversaries, parties, birthday parties will be allowed from that date, hopefully. So next slide, please. Right, another of these questions. What do you expect may still be required of halls at step 4 of the roadmap? Will it be back to business as normal? Now, this is something that ACRE has, this is like a response from ACRE. They're saying that a return to business as normal is probably unlikely. The roadmap says the intention is the removal of all legal limits on social contact, which indicates that the rule of 6 or the 2 households will be relaxed. However, the roadmap also says we are going to have to keep living our lives differently to keep ourselves and others safe. Consequently, we must anticipate that that certain COVID-19 secure measures will continue for some time. We don't know what they're going to be. We don't know if the rule of 6 will be lifted. So, you know, we can only go by what information we have currently. Next slide, Skye, please. Right, are hall managers or group activity organisers allowed to ask whether people have been vaccinated, and can they refuse entry if they have not been vaccinated? So while there is nothing to stop people being asked whether they have been vaccinated, it is highly questionable whether entry could be refused at a community building. Again, we need further government guidance on this. Which provides facilities for use by the whole community. If asked, it should be made clear the purpose, which is that, you know, those who are more vulnerable in the hall and others who may not have been able to be, or may not been able to be vaccinated. and they've got to be able to maintain social distancing from anyone who has not either been vaccinated or had a recent negative test result. Again, that goes back to the importance moving forward for society, expecting people to have regular rapid flow tests, and that will help open up to activities and events. It's too early to say. We don't know what the outcome of the government review is about the vaccination certificates. It would make it easier for event organisers if there was such a system put in place. If there isn't such a system, I think that's when it's going to be more difficult and harder decisions may have to be made for holding certain types of events if vulnerable people are going to be there. We'll have to wait and see what they say. Next slide, Skye, please. Right, so when right back at the beginning where it shows you the list of all of the appendices, Appendix E, we mentioned, it's been mentioned a couple of times through the presentation about special conditions of hire. It's important to have that in place. Now, all halls prior to COVID should have had some sort of hiring agreement in place. You know, your terms and conditions of hiring and using the hall. These, Appendix E, is highlighting all the additional clauses that are required by the hirer to do with COVID, you know, health measures to do with COVID. So if you haven't seen it or heard, and it's on our website, please do start using it with your hirers, because, you know, if it's going to be moving forward about a hirer saying, we didn't know we had to do this, we didn't know we had to take people's contact names, we didn't know we had to ask them to do a QR code, we didn't know we had to tell them to wash their hands and blah, blah, blah. If you have issued the special conditions of hire to cover yourselves in law and for the insurance purposes, you can say to the hirer, well, yes, you did know that you have got to do all of these things, and ensure that the people using the hall know what they can and can't do, because you signed this agreement saying that you understood the terms and you are going to implement them. So that's why it is so crucial to you as managers and trustees, not just to cover your own backs legally and for insurance purposes, but to make sure that your hirers are taking it responsibly, that, you know, they can't just pass everything back to the trustees, that they have got to take on responsibility for the people attending the hall for their particular session that they're organising. So the event organiser, by signing the agreement, is actually agreeing that they are responsible for the managing, that the numbers are do not exceed the capacity, the COVID capacity. They're responsible to make sure people understand the social distancing. Anybody clinically vulnerable, if they're aware of that person, the extra social distancing, if they're vaccinated or if somebody else hasn't been vaccinated. We're not sure yet how that's going to work. QR codes, names and contact details, face coverings and hand hygiene. Also cleaning requirements. They're responsible for cleaning the frequently touched surfaces. Avoid contact with other hirers if you've got more than one room at one time. And to make sure that they're hiring it for an activity that is allowed at that particular step level. Again, go back to the activities table, and it actually lists over 100 different types of activities, or whatever obscure activity you may be having in your hall. I'm sure it will be listed, or something very similar will be listed in that activities table, and it will tell you specifically which date, which step, then that will be allowed to take place indoors or outdoors. And that also, finally, that they also, if they are things like sports performers, that they're also following their own governing bodies as well. So it is important. Don't just think, oh, this is just a sideline. This is one of the crucial, essential things that you need to put in place. Right, next slide. I think we're nearly coming to the end now. Let's see what we've got. Oh, that's just to illustrate the importance of ventilation. And that's just a graphic way of showing that how aerosol transmission of the virus, and you know how that, if there's a good airflow through the indoor space, it can hopefully flow through the open window. So good ventilation. There's information about that, I think, on our website as well. I'll have to double check if it's still there. But right, next slide, please. Right, so the restart grants. Can I just ask a question? I'm going to go on the assumption that all of you have been able to access some sort of financial aid. So rather than everybody saying yes, 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 is there anybody that's not been able to access any of the COVID business support grants? Put it in the chat if you want to.
Can you hear me?
I can, yeah.
Yes, it's Marion. I'm calling from Duffield. We are in a really silly situation. The hall was flooded, actually, before all this started in November 2019. The hall was flooded. So it was then out of action already by the time that COVID started in March 2020. The hall, we were not using it. Then, of course, we had the insurance company put builders in, and then they stopped work, and then nothing happened at all. And so we've had no income whatever for over a year because the hall has not been open for various reasons. Now, actually, as we haven't had any expenses either, because the insurers have been in there, we haven't applied for a grant, and I don't think, in fact, we're entitled to one.
Are you a church hall?
Yes.
Are you classed as a church hall rather than a church?
Yes.
You would be entitled through what they call the discretionary grants through the local authority, or in recent times it's been called the additional restrictions grant. You probably, because that's for church halls, parish council, statutory managed buildings, because you don't have a rates value. You've got no rateable value.
No, we haven't.
Most community buildings have got a rates value, a rates number. They're in the rate system. So they would be eligible for the major grants that have been around. But there's a minority, the church halls, the statutory managed halls, and maybe other types are not in the rate system. So you would then be eligible to apply to the local authority for what they call the discretionary additional restrictions grant. So please, the only thing I'm worried about there is because you were closed prior to COVID, they may look at what your income was in the previous 12 months.
Yes.
So have you approached them and asked for a grant, or have you just thought?
No, it never occurred. It never occurred to us to do so because we couldn't open anyway.
Right. Okay. We'll
it never
talk
occurred
about
to us.
No, it may be that we need to look into it. Are you Erewash?
No,
Is it Erewash or
Amber Valley. Amber Valley.
It's Marion. Okay. Well, we'll talk about that at a different time, Marion.
Okay,
but that's
yes.
interesting.
Other people don't want to know all
different
this
situation. No, that's fine. No, we will help where we can because they are time limited. So it's 6 months down the line. You don't want to find out that you could have accessed support, but that it's past the deadline.
Okay.
So I like to identify any of those that are struggling, because if we don't do it now or look into it, it might be too late. It may be that you're not eligible, but if you don't look into it, you'll never know. So
no, all right.
That's an interest.
Thank you.
Okay. So to recap on this, the restart grants are the ones that were announced that started from April 2021. So these replace all the former grants that were available. So previously it was the local restrictions support grant, and before that it was the retail, hospitality and leisure grant. So they come up with these wonderful names that confuses everybody. Now they're called restart grants. So they're the ones for this financial year. Luckily, the government have extended business rates exemption. Now, a lot of halls don't pay any business rates, but some may have to pay a small amount, up to 20%. So if they are, it depends on what their local authority stipulates. So if you were having to pay up to 20%, then that business rates holiday will mean that you don't have to pay that 20% up to the end of June. So again, it depends which local authority that you are situated in. I know Derbyshire Dales give charitable halls 100% rate relief. So that business rates holiday makes no difference whatsoever if you're located in Derbyshire Dales. But I'm not sure about the other local authority areas. So then the Restart grant, I don't know, some local authorities contact you directly and say, please apply. Others, they expect businesses and charities to apply. Now, my fear there is that lots of people may not be aware that they can apply for these grants. And because it's down to them to apply and approach the local authority, they may miss out. So I keep banging on about it and hopefully keep putting it in the e-bulletins. I know in the very first retail hospitality leisure grant, somebody phoned me at about 10 o'clock at night, the day before the deadline, the very day, saying, well, I think we're not sure if we're entitled. So we had to act very quickly on that last day. And after a bit of toing and froing with the local authority, they ended up with that £10,000 in their bank account. So it's crucial that you don't leave things to the last minute. And it's worth looking into. Even if you find out you're not eligible, at least you will know, and you'll know the reasons why for that. So the new Restart grants, I think it's again, it depends on your rateable value. So up to £15,000 rateable. Not. So my mind's gone blank now. Is it 150,000 rateable value? It will be, won't it? Not 15. Yeah. Or under, you can higher rateable value brackets. It can be 12,000, and very large premises that are £51,000 rateable value, they could receive up to £18,000. So these are quite substantial grants. And also, you may be a property that maybe just has a community shop, not a community venue. Then there is a Restart grant for what they call non-essential retail. And that's up to £6,000, depending on your rateable value. So it's definitely worth looking into. I know Derbyshire Dales, on their website, I looked, it did say that people need to check their spam folders. They've sent the invitations out for people to apply. But obviously a lot of people have got back to them and said, well, we only just found it in the spam folder. So things like that, do be aware and look out if you have been contacted by your local authority. And if you haven't, I would look on their website, find out how you can apply or how you can inquire about it, because it's a lot of money and it helps you get through this third lockdown.
Can I just cut in there? I'm sorry, I know you need to say, but I think it's rather important.
No, that's fine.
With Derby, they were very confusing with the information they sent out. They actually said in the letter they sent out for you to apply that if you had been receiving the additional restriction support grant, you probably didn't need to apply. Yet when you went onto the website, it came up with the application form, and I have queried it with them, and they expect us to apply. So yeah. I think everybody should be applying, and if you are confused, definitely put in an application and don't assume you're going to get it if you've been receiving the others.
That's very good advice, John. Yes, yeah. That, in a way, that's my motto. If you're not sure about something, do it anyway, or get on the phone and find out, because if you sit back and wait for something to happen, it may never happen. It's down to you as the trustees or the parish council or whoever to actually act on it if they think that nothing's happened. But again, the additional restrictions grant is for those that are not in the rate system. So people like statutory halls, parish council managed halls, if they're not sole trustee, like they are at Holland, and Paul will know the difference between a parish council as a statutory hall and a parish council as a sole trustee, because that makes a difference to what grants you can get as well. So it can be quite complex. And I also think that sometimes the local authorities get confused. I don't say it, but I know nationally, all the local authorities, I mean, if you challenge them, sometimes, you know, they may have misinterpreted, they may not fully understand what sort of organisation you are. That there has been a huge variation across the country, and they're all following the same regulations. So again, sometimes it's interpretation by the local authority itself. So if you're not sure, and you know, I'd get in touch with me or challenge it with a local authority. I know we've helped several out that were quite complex. You know, for example, there was a hall that was a charitable hall, but it was not listed in the rate system. So we had to challenge that, and they became listed on the rate system, which then meant that they were able to get all these retail, hotel, leisure grants, and then the local restriction support grant, and then now the restart grant. So there are going to be those odd cases where the local authorities got it wrong. So again, don't be afraid to challenge and query it. Like John says, you've got to act, you've got to be proactive, not just sit back and think, well, because they've not contacted me, obviously, you know, obviously we can't be eligible. It's not necessarily the case. So, okay. Have you, I mean, I don't know what the timing was. Can you just shout out or say, have you had this latest restart grant? So they're not actually issued, the money's not being issued yet then, by the sound of it. Nobody's received it then.
We're getting it in a week's
Okay.
time. So in
They're
fact, tomorrow actually, 29th.
Yeah. Yeah.
The forms in bold.
All right. So Josie says error wash. Yeah.
The forms in
Yeah.
Bolsover got released last
So-
Friday.
So it's recent or imminent, by the sound of it then. Yeah. Well, that's good news. Well, I'm glad that you are getting it through and it is coming through. Actually, I think that the grants throughout COVID have been very generous. Small halls probably are going to be better off, and maybe the larger premises may be worse off. But it's a one size fits all scheme. So the majority of small village halls, despite being closed and having no income, they're probably slightly better off at the end of the day with all the grants that they've been in, you know, if they've been accessing them, they're probably been in a way by that. Okay, any more questions to do with grants? No, well, if you do, we can. Yeah, there's also at the bottom of that slide, there is a loan scheme. It says not for public sector, so it is just for charitable halls, voluntary community sector halls. So if, and I don't know how it would really apply, but if you were badly affected by the pandemic, there are these schemes where you can, I doubt whether it's really applicable to small charities, but I've not looked into that, but that is another option if somebody was really badly affected and they needed more than what the grants have provided, then there is that recovery loan scheme there. Okay, we'll go on to the next. I don't think there's many more slides. We've gone 12 o'clock, haven't we? Okay. I'd lost track of time there. I apologise. This is just to show you the ones that may not have accessed the new addition to Appendix D. This is the activities table. This is just an example of how ACRE have done it. There's about 6 or 7 pages like this. So they will list down on the left-hand side all the different types of activities. And then the 4 columns there are representing the 4 steps of the roadmap. So they're ticking when it is allowed, as you can see. And then any comments or anything that's different, they're writing at the side. The very latest version of it, the second version of it, again, anything that has changed from the first version, any of these slight tweaks that we've talked about earlier, they've highlighted them in red. So you can see what's slightly changed. So they're making it as simple and user-friendly as possible. But do download that. That's going to be invaluable, I think, moving forward. Right, so the next one, Josie. Sorry, Skye. Right, yeah, that was the last one. Right, so any final questions then? We can go back to the full, the gallery view, Skye. Then we can see people. Right, okay. Well, I hope you found that useful. It's very difficult to pitch this sort of session rightly, because there are those of you that are probably very fully aware of all what you've got to do, and there may be those halls that haven't done anything yet. So to get that right balance in the middle is you know, a little bit tricky. So bear with us if you haven't learnt anything today. Some of you may have learnt a lot. Please do email me if there's anything you want further clarification on. As you know, we'll do what we can. So let's just, before we finish then, look what's in the chat. Is there anything there?
So step 3, are classes allowed, such as art, gardening, indoor with social distancing?
Yeah, yes, it's pretty much back to normal at step 3. A lot of activities, as long as they follow the COVID rules. Again, go back to the activities table and it will show you at step 3 the types of activities that will be allowed.
And
yes,
then in regards to singing, what about one-to-one singing teaching?
I think if they're socially distanced, I would say that's allowed. Have a look in Appendix D, the main Appendix D, to see if it says anything about that, or the activities table. But I think one-to-one, or if you're socially distanced, should be okay, and good ventilation. Is it a professional singer? You know, like a professional tutor, because they would be doing a job, they're providing a service. Because amateur choirs can practice indoors, so I think one-to-one training would be okay.
And then there's a question from Janet. I'm not really sure how to actually ask this. It was, would they still need to be wearing masks when walking around and when seated? I'm not sure what date that refers to, but it says previous guidance was to allocate chairs/tables to each group not unusable by other groups or left for 72 hours, sorry, between each use. Is this still a thing? I'm not sure if that means now or
whenever, really.
Okay.
Yeah, there's lots of guidance about either, you know, allocating chairs to groups and not allowing others to use them, and then leaving them for 72 hours before anybody else was allowed to use them, and using, I don't know, carpet cleaner for upholstery and all sorts of things.
Are you talking about upholstered chairs? Yeah. I think nothing's been said about that, so I'm assuming that the same guidance for soft furnishings would apply. I know there was an inquiry about the fogging of carpets. I did run a session last autumn on cleaning and hygiene, and we talked about fogging then. To be honest, I've not researched back into that and whether the regulations have changed. I've not had a chance to have a look at it. So whoever had asked that question prior, I'm afraid I can't answer that part at the moment about the fogging. it's difficult when you've got carpets, but it may be that now they think that the rates are perhaps low enough to then not require fogging, but that's only my thinking on that. I don't know what the official guidance is, so we'll look into that one.
And then I've got one that says, previously it was recommended we have a COVID secure place to isolate people who develop symptoms when in the premises. Is this still required at steps 3 and 4?
As far as I know, I don't think that's changed. We've not said that that's been lifted. So definitely at step 3. I mean, it says from step 4 that all measures and social distancing is lifted. But if you still had somebody, I mean, we're not going to say that COVID's still not around. So if you have an event in the hall, you're running an event and somebody has COVID symptoms, I think you still need to follow that same plan. So you need to have somewhere that you can quickly get them away from the rest of the group of people. And obviously, if they can go straight home straight away, that's ideal. But if they're relying on a lift or a taxi, then they can't. So they've got to be put somewhere that's away from the rest of the group. You would obviously have to ask the rest of the group to go home and follow all the thing. But I think that would still apply.
And then just one last one.
Because who's to say? Maybe it might be down the autumn, I don't know. So you've got to
plan. There was just one last one that someone wanted to know about fogging. And is it mentioned in the documentation?
I can't say for sure. I'm trying to think where I found out about the fogging. I would think it probably does, but I can't tell you which appendices. Probably a D. You'd have to look through.
And then also, is the activities page in Appendix D?
It's a separate document. I don't know why they've called it Appendix D. They should have given it another in my opinion, but they've called Appendix D and then Appendix D. It just says activities table. They're not joined as one document. So when you're downloading, it doesn't say Appendix D2, which would have made it more sensible. But yeah, they are two separate documents. But the activities table is this one that's got, you know, the lists of what you can and do and the 4 columns. So you will find that invaluable. I'm finding it invaluable to advise people by following this. Now, Hathersage, you've been turned down for the last 2 grants. Have they given a reason for that, Martin?
We did reduce our income by 30%, which was, in my view, between the dates, which was December and December, which is actually untrue. But I did send them the information. But anyway, I thought 2 out of 4 wasn't bad. They're small. We've got about 3 grand out of them in the recent times, but.
Yeah, and hopefully the restart grant you should apply for as well.
Right. Okay, that's the one that got.
That's the one from the 1st of April this year, which is the current one on the website. So do look into that.
Right.
Now, my understanding is that even during lockdown, if halls were open for essential services, or things like a food bank, key workers, children, or the local school had to use the village hall, it shouldn't have excluded them from accessing the grants because they're providing essential services. So it may be that the local authority are taking a different view to that, but I'll hopefully perhaps get some advice on that from ACRE. So again, it's looking at and maybe challenging again why, because you said it's untrue that your the amount that your income was reduced, you said is actually untrue. So it might be worth challenging it, Martin. Yeah.
Well, yes, Well, yeah, I did, but
Yeah,
probably more important is this restart.
the
That's how we
restart.
got-
Right?
Yeah,
Yeah.
because the Derbyshire Dales are quite good at sending you emails saying you should be applying for, even when they've rejected you for it once.
Yeah. Have you not had an invitation? I would
Not that I'm aware of.
phone.
No.
Yeah. Go on the website, see if you can apply directly, or if not, if there's an email or a number, you can query it, contact them saying, why have I not had an invitation for this latest restart grant? You are a charitable organisation. You will have a rateable value.
Yes, we do both those, and we got money, quite a lot of money, right at March 2020.
Yeah.
So that was very generous.
Okay. Yeah. Well, as I say, it is worth pursuing these things.
I think Derby
Right.
dealt with this very differently, because one of the problems I found was the form doesn't give you any chance to add any comments. You answer yes or no to all the questions.
Correct.
So,
Exactly.
so we were in the position that we had a company called Community Links in during the day, which is our main income, to be honest. And they're an essential service. So we've been getting the grants, but I actually sent in a separate email to them saying, this is our position. I believe we are still entitled to grants. They've never come back. So I've got it on record that I've informed them, and we've had everything so far. And I guess we would be marginal as to whether we've dropped by 30% on the income, because they're our main source.
I'm reading a message on the chat. It says, where are the appendices on the ACRE website? They're on our RAD website. They're on the RAD website. All of the documents are available. Look for reopening of village halls, and it'll be on that reopening page, all the appendices and the latest version 10 information. Yeah, you've put that, haven't you, Skye? Thank you. Right. Well, we're going to be running these monthly. So the next dates, 26th of May and 23rd of June. So those are the 2 dates I can say now. Similar sort of format. It's really going to be catching up on what the tweaks are, what is going to be slightly changing, and to give you the opportunity. I mean, we've not had a lot of opportunity to have a discussion with you, but as we go on, and if there aren't many changes, then hopefully we can have more of a discussion and perhaps learn from each other about your experiences of reopening, what works well, what hasn't worked well, you know, if your hirees have been confused with the information, as you know, that sort of thing. So I think moving forward over the next 4 or 5 months, it would be good to learn from each other as we go through the process, basically. And let's just hope it goes according to plan.
What was the second date? It was 26th.
With 26th of May.
Yeah, and
23rd of June.
Okay, thanks.
And then they're every 4 weeks till the end, until September. But we're just issuing a couple of dates in advance for now. Okay.
I just say thank you very much. Thank you.
Thank you.
Can I ask one more question?
Yes, yeah.
Do you know the terms of the recovery loans in terms of interest rates? Has that been published?
I haven't looked at it. It may have been published, John, but I've not looked into it.
Okay, I'll find it.
All of the information will be somewhere on the website, government website.
Yeah, I'll have a look into it then. Thank you very much.
Yeah, okay, right. Thanks for
very
joining
much.
us this morning.
Thank you very much.
Bye.
Bye. Cheers. Bye.
Okay.